All right. Good morning, neighbors. I'd like to introduce you to a friend of ours. Her name is Angie Rosenbaum. Until we can meet again, we are a public education campaign. We want to let you know about the services that are out there that can help you make informed decisions about your life. And Angie is an occupational therapist. She's been working with my dad. And I have a lot of questions about how is OT, occupational therapy, different from PT, physical therapy?
Yeah, that's a good question, Eileen. I get that asked of myself quite a bit here. So, occupational therapy typically focuses on the everyday routines of a patient. So, the participation in those daily tasks, such as dressing, bathing, toileting, laundry, kitchen management, making meals, things like that. And physical therapy, instead, they focus more so on balance, gait, mobility, safety, and strength in the lower body. So, although there's, the specific things that we focus on within the separate disciplines with the OT and PT, we ultimately collaborate together to do what's best for the patient to maximize their independence.
Yeah. It's interesting because people think, well, I know how to do all those things. But how does OT and PT help someone with maybe cognitive issues or dementia? How does it help them stay independent longer?
Yeah, that's a great question. With occupational therapy, typically what we would start with is doing a cognitive assessment, which would give us some more information exactly about the status. Where is this person at cognitively, so that we can provide the appropriate interventions and modifications. A lot of the work we do is communicating with the patient, the family, the caregivers to ultimately try to maximize that person's participation and engagement with those activities that they've been doing all throughout their life that may be a little bit more difficult for them now that they have these cognitive impairments.
It's interesting. So you can actually help someone with dementia stay in their home longer. How, do,
Exactly.
how does having OT, occupational therapy, in your home help you adapt to the changes, say illness like my dad or an injury, and allow you to stay in your home? What is the goal? What's the goal of occupational therapy?
Well, yeah, and I think an important note to make right now is trying to be proactive with therapy. We don't always just get involved with residents that had an illness or an injury, but also we can work with residents initially for maybe just maximizing their strength or balance or safety to hopefully prevent those injuries and illnesses from occurring. But ultimately, the goal for occupational therapy is to engage those patients in things that they love to do and enjoy to do, because ultimately that's what makes us us and improves our quality of life. And that's what we do as OTs, is trying to maximize that quality of life.
Okay. So, if somebody were to say, you know what, I'm having a little more trouble, I don't want to call it. Well, what would they do? It's like, you know what, I'm having more trouble with the steps, or my wife is yeah, she's not doing. She has a little dementia and she's struggling. How do they know what to ask for, and who do they call?
Yeah, you can just give us a call here at Therapy at Home, and we're happy to reach out. Typically, the first thing that would be needed is a doctor's order for the therapy, and we're more than happy to help facilitate that and work with you to try to give you the best plan of action.
Okay, so that would be the first step, and it so someone would come out and evaluate and let you know what you needed. You don't have to know. Okay.
Oh, exactly. No, no. Throughout the evaluation, we would go through quite a bit of questions, getting to know you and the patient, the family members, and try to determine the best fit for them as far as what they could really benefit from. So they're actively involved in their care, because that's what's most important, is that we're having goals and working on things that are important to that patient and the family.
Okay. All right. Well, I really appreciate all that you're doing with my dad, and the fact that you come to his home and you help adapt his home to his situation is huge, because if he was going somewhere, he would come home and wouldn't remember or do it, but you're helping him to remember what to do. And I see that in him. So I appreciate what therapy at home and what you're doing, Angie. Thank you very much. And
Oh,
thank you
thank
for,
you.
yeah, thank you for taking the time to do this and let our neighbors know. If you're, we're all been isolated so long, and there's probably somebody out there listening that, give therapy at home a call, and you'll talk to somebody like Maddie will answer the phone and help you find the occupational therapy or physical therapy that you need to stay independent, to stay in your home, and to get back where you were before COVID. Okay.
Exactly.
All right.
Definitely. Thanks so
Thank,
much, Eileen.
you're welcome. Thank you, Angie.